This week, Florida Governor Rick Scott met with several members of Congress to ask for more funding to help fight the spread of the Zika virus in the Sunshine State. Currently, Florida leads the nation in travel-related cases of Zika with 112 cases. Joining me now to discuss this epidemic is Dr. Chau Johnsen Kelly from the University of North Florida. Doctor, thank you for coming by.
Thank you.
Where are we at now? Governor Scott is trying to get more funding. Did Zika creep up on us? Did we know it was going to be this bad?
Oh, no one knew it was going to be this bad. There was no way to predict something like this. Zika has only been in, the Americas since about 2013, 2014, and it only came on our radar in the last year, actually within the last 8 or 9 months. So there's no way that we could have predicted what's happening right now with Zika. And the funding picture is actually extremely important. The Senate just agreed to some funding for Zika. I think they said it's somewhere around $1.1 billion versus the $1.9 billion that President Obama had requested back in February. So there is some movement, but it still has to go through the House before it is finally approved. And there's some political issues going on with regard to approving that. So
how does the threat of Zika compare with some of the other infectious diseases we've seen over the years in our area?
Well, in some ways, Zika is much more frightening than, say, West Nile. So West Nile was the last big sort of new invasive disease that came in from parts elsewhere than the United States. And West Nile, of course, affects people. It can kill them. But it doesn't seem to have the complications in terms of secondary complications, such as Guillain-Barré syndrome for adults, or with Zika, it's the microcephaly for babies and newborns. So yes, Zika is quite a dangerous situation that we have here.
What the governor's asking for more funding. What is it we need to be prepared with? I mean, what would be the best way to those dollars to go forward to help fight the spread of this?
Okay, so the dollars need to get distributed to county public health organizations and officials in terms of mosquito mitigation, in terms of educating people and working to do things like drain standing water, make sure that people keep their yards clean, make sure that you don't have a bunch of trash laying about your yard. These are aggressive mosquitoes. These are what are called Aedes aegypti and Aedes albopictus. These are also invasive species. So this is another factor that is complicating this. These mosquitoes also are urban mosquitoes. They like people, and they like to be in urban spaces. They also breed really well in very small quantities of water. So they're not sort of delicate creatures. These are creatures that have adapted really well to living in and around human populations.
Dr. Chau Johnsen Kelly, thank you very much for joining us this morning. Very informative. Right now, the Florida Department of Health is requesting 5,000 Zika preparedness kits to help residents become prepared if Zika gets any worse.